Good morning, everyone. This is William Connectal, and I have the pleasure of providing you a broad global review of experiences with financial tracking before we move into Julian's reflections on Niger's experiences. Could you please pass the next slide, please? I'd like to begin today's presentation with this one image that captures the three things we're trying to support countries to do: planning and costing, budgeting a la resource mobilization, and financial tracking, which is around the utilization part of this diagram. Just as a broad review, under the planning phase, this is where costing of your national nutrition plans is important. And MQ Sun in 2020 reviewed Sun country experiences. By focusing on 26 national nutrition plans, the findings were that these plans often struggled with financial frameworks, identifying the gaps between how much plans cost and how much money is available, or who will pay for it and when. This led to the orange in the bottom to a financial gap analysis for multi-sectoral nutrition plans that I'll be happy to discuss at the very end of the slide. But with these three things together, the presentation I'm going to provide today is going to focus on the left blue part of this diagram, the utilization. Could you please go to the next slide? I wanted to include this slide here for everyone just as a background of 5 things that financial tracking will accomplish that works within the Sun movement's principles of multi-sectoral engagement. It doesn't really matter which type of method of financial tracking a government and its stakeholders do. If it's done right, it's going to accomplish these several things. Accountability, coming about by the fact that you're bringing people together to analyze your finances. And the sectoral dialogue and coordination is extremely important here. Nutrition-sensitive programs has a wide degree of interpretation, and it is by coming together and agreeing on what will and will not be included that accountability is derived from the exercises. Can you please go to the next slide? So across 62 country experiences between 2015 and 2020, we have found 5 predominant ways in which you could track nutrition-related financing. And in the next slides, I'm going to review each of these methods. And what I want to focus on is how long it takes, what type of effort is there, and how long does the validation from push to shove actually take. Could you please go to the next slide? One of the most exhaustive and encompassing ways you can track nutrition-related financing is by nutrition public expenditure reviews. They are incredibly detailed. They can provide information on spending over 3 or 4 years, at times 5 years. They will identify in an encompassing way everything you have done. For example, in Bangladesh, a public expenditure review focused on 21 ministries, departments, and agencies and identified over 180 programs. The con to this type of method, and we will see in 2021 especially, is that it takes a very long time to be able to perform the analysis and validate the results, between 12 and 18 months. So this is a type of method that is very useful to identify everything that is being done, but it takes a very long time to do it, which is a significant cost when we want to appraise, say, COVID's impacts on budgeting generally. Could you please move to the next slide? System of health accounts is another way that some countries have tried to analyze what they are spending. The focus is on actual expenditures, which produces some technical problems. By focusing on expenditure data, there is often a 1 to 2 year lag, as you would know. This means that while 38 countries have done experiences, and I provided a link that you can review after this presentation, my experience supporting countries has not heavily used the system of health accounts. Could you please move to the next slide? The Clinton Health Access Initiative resource mapping tool often called the CHAI resource mapping tool, is another way that several countries in the movement, namely Malawi, Rwanda, Liberia, Lesotho, and Zimbabwe, have done in the past. It is a health sector focused tool that often does not include expenditure data outside of the health sector, but it is extremely granular in detail. You can identify everything in your health accounts that you think is directly or indirectly related to nutrition. As I have been supporting Sun Countries since 2015 in the realm of financial tracking, I can explain that the level of detail provided by the CHAI resource mapping tool is extremely granular and extremely focused on the health sector. When I reviewed Lesotho's information in 2015, I was amazed at just how deep and how clear financing could be identified, almost to the individual recipient. Could you please pass to the next slide? Thank you. Public Expenditure Tracking Surveys, or PETS, is a tool for public units involved in service delivery. It relies on administrative and accounting records, and the possibility to isolate nutrition expenditures depends on the extent to which they are isolated in administrative accounts. Sometimes you can just not find this type of information. It has not been heavily used across the Sun movement in the last 5 years, but I have included a URL link that you can use if you are interested in knowing more about this kind of tool. The cons of this, as well as the previous 3 types of methods in financial tracking, is that the sustainability mechanism. They often require significant amounts of technical assistance. They can only be done once or twice. The public expenditure review is extremely exhaustive. You can identify information 4 or 5 years in one exercise, but that takes a very long time to do. And after you've done it, you do not need to update it the next year. This is the same thing with the PETs. They are a one-off type of study, and I want you to keep that in the back of your mind. Could you please move to the next slide? Finally, there is a Sun budget analysis method that was designed initially as a last resort in 2014 as a method that if one of these other types of methods were not being used in country, you could review the spending in your national budget. This is both allocation and expenditure data, with the caveat that expenditure data often has a time lag of 1 to 2 years. You can identify information across your ministries, departments, and agencies. It's at the program level. And using this method, you can also go in the subnational and look at allocations and expenditures at subunit levels. The benefit of this type of method against the others is that it can be performed quickly, within 1 or 2 months following government ownership of the exercise and allocation of duties. When and where TA is provided, sometimes it may take more than 2 months to do. But it is designed to be done annually and can be done even faster. Peru is an excellent example where they can update their budgetary information for their select programs in an online tool every month. What this does not cover, however, is it is a breadth over depth exercise. You will not capture everything over the sun. And it will not tell you everything that is being spent on nutrition, but it will show what governments in their national budgets are allocating and expending related to nutrition. It can be and often is sustained by governments without technical assistance, but sometimes TA is necessary depending on a country-to-country basis. In some Sun movement countries, a focal points team may only be 1 or 2 people, and so they may require technical assistance to do the data crunching parts of the exercise. It's also designed by the attribute that you are to bring your stakeholders together, agree on what you want to include in your national budgets, and then track it. The first time a country has done this is the most resource intensive. It takes the longest to do it. But updating the exercise once the scope and boundaries have already been determined means that this is designed theoretically to become easier to do year after year. I say theoretically because at times Budgets may change, individuals may change, and so there is at times gaps and lapses from updating exercises, but across the board, it is designed to be sustainable. Could you please go to the next slide? So 2020 has been a very difficult year for the world, and our sun countries are no exception. 40 countries in the movement will see, on average, a reduction of 4.9% in projected real GDP. 16 countries will see an increase in 1.4% on average of projected real GDP, which across the movement says that the sun country will, on average, see a minus 3% projection in real GDP. 2021 will see a recession deepen alongside the COVID-19 response, where we can expect at least one more wave before vaccination programs could even be rolled out. That is the reality within which we took 2020 to reflect on sun country experiences, look at what works, what could be better. And in the next 2 or 3 minutes, I would like to review several of these updated knowledge management products that you can review when you are free going forward. The first is a supplemental guidance note for the budget analysis exercise. 2020 was a moment of reflection because with the way things were, a lot of planned activities could not be implemented. So instead, we went back to the drawing board. We looked at how the method has worked in practice and how it could be better. That designed the supplemental guidance, which fine-tunes and gives further recommendations both for TA providers and for governments to consider if they opt for a sun budget analysis type of method to track finances. We also did a deep review of the various types of costing methods, of which there are 10 used across the movement, and of financial tracking methods, of which the 5 I have described in this presentation summarize the several ways that you can hope to track financing across the movement. Finally, a joint FAO-SUN publication took this sun budget analysis method and focused on methods and investments in the agriculture sector. This is a new publication, and we will be having a webinar in early December to review the uptake of this and how this can be rolled out. Finally, I had mentioned at the very beginning of this presentation that a review of national nutrition plans showed that the financing framework was something that often lagged behind other aspects of a national nutrition plan. You would either have problems identifying the cost or identifying your current financing against those costs. And 2020 proved as the perfect moment to try and identify through this new product, conducting a financial gap analysis of multi-sectoral nutrition plans as a way to support countries. Because 2021, as you know, is the moment of 2 mega events, the Food System Summit and more importantly, the Nutrition for Growth Summit, where commitments, financial and both political and in kind, will be made to support nutrition financing. What we have seen in sun country experiences in the last 5 years is that certain methods are designed for certain things, and they are complementary. Big nutrition public expenditure reviews identify everything under the sun. Budget analysis exercises, by sacrificing breadth over depth, do not give you the whole picture, but they give you a pretty good picture. So a country that would have identified 21 ministries, departments, and agencies with 180 programs would take that big analysis and say, well, 4 ministries, departments, and agencies with 15 programs captures more or less 80% of all financing we found. So we're going to focus on that with our budget analysis exercise. And that has been the experience I have seen replicated most successfully of taking very in-depth financial tracking exercises, trying to fine-tune them, identify what you can hope to find in a national budget, and going forward. In 2021, given the economic forecast and the COVID response, we can surmise that very few countries will identify increased financing for nutrition or almost for anything. It is the reality we are facing. But quick, efficient, and fast financial tracking exercises in Q1 and Q2 of 2021 can and will be used to input into gap analysis and into nutrition framing commitments for the N4G. That is how we plan to support Sun countries going forward. And now at 15 minutes, I hope I have given you a very broad review of the types of options that are available to Sun countries when they hope to track financial tracking. And if you have any questions or comments, I'd be happy to answer them after we go and reflect on some country experiences from Niger. Thank you so much for your time, and I hope you learned a thing or two in this presentation.
We certainly did. Thank you, Zach, for this comprehensive presentation. So now we'll move on to the summary of the budget analysis that was done in Niger end of last year. So I had the difficult task to present the work of the team in Niger. So I hope I won't do any mistake, and I will reflect well on their experience. So this exercise was done end of last year. It lasted a couple of months with quite a lot of partners involved, and it was under the HC3N, which is the national body representing the president initiative to tackle nutrition sectorally, so it's above the line ministries. And they did a budget analysis of the years 2016 and 2017. So next slide, please, which is slide number 18 for those who are following by PowerPoint that I just sent by email in case you cannot see it on the screen. So in Niger, so the HC3N has endorsed a costed national nutrition plan, and during the launch of the plan, the government pledged to finance at least 15% of the plan through national budget. So next slide. So the basic general objective was to analyze the budget allocation and expenses of the government dedicated to nutrition, and looking at the years 2016 and 17, and looking at nutrition specific and nutrition sensitive interventions. So let's work out a bit more in detail the methodology. What are the different steps they have done? So it was done in 4 different steps with good work on the preparation, which was the first step. And they first had to set up a technical committee in charge to inform the stakeholders and find a consensus on objective and scope of the study. So this technical committee was existing committee who is in charge of the M&E of the National Nutrition Plan. So that was done end of October. Then just right after that, they called for another meeting to present the methodology, present the committee, and to also agree on using the tool Boost as their main working tool, which needed 1 week training for that. So then came the step to access the data. So they use the tool Boost to compile their data. It's an Excel tool. And they extracted the data line by line, ministry by ministry, to identify nutrition-related budget lines using the NNP as a basis. So the third step was to validate and interpret the data. So early December, they also gathered with the technical committee that was decided to validate the selection of budget lines related to nutrition. So to identify if this was a budget line related to nutrition or not, whether it's nutrition sensitive or nutrition specific. And they had to make a 2-day workshop with focal points of sector to, well, take into account the expertise of the different sectors and categorizing intervention into specific, sensitive, and investments. I mean, this new category, because their interpretation is that investment is in the long term, and so they were looking at more interventions that were active right now. So they removed the investment for their analysis. And then, which was a very difficult exercise, the waiting to classify, once it is classified, to agree whether it's when it is sensitive, to agree on the percentage of the budget that could be counted. So whether 10, 25, or 50%, that's the different threshold they decided to agree upon. And so they had this 2 days workshop to decide what should be the weight given to any nutrition sensitive intervention that was identified. So finally, the fourth step was to analyze and interpret using the metric of boost, which apparently was quite a good experience. And the finalization and dissemination of the results are available on their website, which is quite well done actually. So that even if it is in French, it's really a comprehensive website, and you can have a look. It's well done. So just to highlight some few key results. So they identified that the total budget allocation to nutrition has decreased of 19% between 2016 and 17. That the external resources had a major contribution in the national budget, and that there was still an important gap between allocation and effective expenditure in nutrition, respectively 65% and 77% in 2016 and 17. And there was quite a lot of variability between sector and over time. And so they calculated that the budget allocation for nutrition from the state represented 3.4% of the total national budget. State resources from 4 ministries represented almost 50% of the budget allocated to nutrition. So based on that, so I'm going very quickly on the results. It's more to look at the methodology, the approach, and the lessons learned. After this exercise, they decided that they want to complete the same sort of analysis as you were mentioning, that to conduct this sort of quick and simple analysis over time. And so they are planning to do this for 2018 and 2019 period. They will continue regularly the study and include contribution from external partners that are not tracked in the national budget, because this was just an analysis of national budget, and the investment from external partners are sometimes not included or not visible in that budget. They want to continue using the tool Boost, and reinforce the collaboration with the Ministry of Finance. So that was a good exercise to identify this link that can be reinforced. And for kind of advocacy to ministry, they want to advocate to design nutrition-sensitive investments towards those that have a nutrition objective. So really have a clear objective within those intervention that is clearly related to nutrition, and also improve metadata on project and program to facilitate budget analysis, because they had a hard time to really find that objective and get more information about each intervention that was identified in the budget line. So merci, thank you. That was for the Niger presentation. Then we had a discussion where I will try to summarize some key points of discussion, and please, Perrine and Zach, if you want to take the floor after that to complete or adjust, feel free. So regarding, if you can, so regarding the choice of the methodology, so budget analysis has been frequently used because it was also in an equation with one objective of the sun to track national investment in nutrition in national budgets. But we have seen Zach has presented different sorts of methodology, different approach, and it's really important to adjust the methodology towards your objective, what is your goal, and then identify the methodology that is best suited for your approach and your context. We've seen also that the methodology is quite adaptable and needs to be adapted to the context, to objective, as I said, but also to the availability and accessibility of the data. Some countries would have more or less detailed or information available, more or less metadata available, and also even within different ministry, you may have different level of accessibility and availability. We also mentioned that comparing countries was not very wise because the methodology could be quite diverse and different and not comparable, and that's not the objective. The primary objective is not to compare countries, but to respond to an objective within one country. And also there was a small discussion point with Côte d'Ivoire, who is planning to have a mixed method, mixing the different approach that was mentioned by Zach, which can add some value as one method can build on the other, but also bears the risk of double counting. So that's a risk to bear in mind. The experience we gathered of budget analysis, so focusing on budget analysis, we've discussed and seen from Niger that it took them quite a long and detailed and rigorous work to identify behind the government line what are the intervention behind those lines, and really they had to be very rigorous and to look at activities line by line with a group of experts. In Niger, they differentiated, as I mentioned, investments from activities. The weighting was not an easy work. Each intervention is classified as sensitive, has to be weighted on 10, 25, or 50% in the case of Niger. So this decision is taken by consensus, and that can be sometimes quite hard to reach within the group. And there was quite a lot of discussion during the past webinar that this weighting is done by consensus, but that the consensus must be built on the evidence of the relative impact of the intervention of nutrition. It's not just a consensus by opinion where a group of experts agree on something. The agreement should be based on the relative impact of each intervention, and that's really that's a tricky part. And the criteria for being agreed should be very clear. And the criteria is what is the impact of this intervention on nutrition. And reaching a consensus doesn't automatically mean that the consensus is based on objective evidence of the impact. So we had some discussion around that. We identified quite a few risks as attached to the approach. The weighting being as the risk to be subjective. Looking only at national budget is the risk of missing investments from partners that do not always appear in national budget. Also in context with emergency, risk to miss information on some important contribution. So this raises the issue of the gap in tracking contribution from partners in the national information system as well. How to deal with this, and this is just some question and experience. So quality control is needed, being rigorous on the methodology. So building the consensus of weighting based on evidence of impact, not on personal interpretation, which is easy to say, not easy to do. And one thing that can be done to ensure that is to make sure that relevant expertise is represented within the groups, that there are some nutritionists and not only statisticians and economists in a group who are deciding on the weighting. There is a need for a quality backup from experts or maybe from the global level to support the weighting based on evidence. In Niger, they proposed the idea to have a kind of a task force to check the weighting based on evidence. In Burkina, they mentioned that it's difficult to conduct this weighting exercise without guidance without clear guidance and a kind of overall approach that is well identified and clear and transparent. And also one thing that is basic for data analysis, but it's important here is to adjust the interpretation with the methodology, not to over-interpret, being very clear on the limitation, what it can do, what it cannot do. In case of the budget analysis, as you mentioned, that it's a simple and incomplete picture, but it's quite quick. It's a starting point, and it's not a very detailed, very thorough analysis, but it can be useful. And as you mentioned, with the COVID, we will, in next year, if we want to do some quick analysis of what is the impact of the COVID on budget for allocation for nutrition, that can be a good exercise to have this sort of quick picture. And budget analysis methods are adapted, need to be, it's not adapted in every context, it's a need to be adapted, and does not allow for cross-country comparisons. If we continue, so maybe, well, I will let you comment on that, Zach, but with a recently released recommendation from the Sun, so I pointed out here some keywords to avoid comparison between countries. It's a simple, but from this starting point, you can elaborate more sophisticated and complete mechanism to have a more complete picture, and that the weighting is still an exercise that is difficult to handle, and that is still on debate. So I stop here. So we have some time for the discussion. Maybe just before we start the question, Perrine and Zach, as you were part of the webinar, last webinar with the French-speaking countries, if you want to complete or have some other remarks, Zach?
I think you gave a fantastic overview. I would just like to comment very briefly as to why it's not designed to be comparative. The reason simply being is that there is consensus on what is nutrition specific, but there is no real consensus internationally on what is nutrition sensitive. Over the last 5 years, analyzing 50 different Sun country experiences of analyzing their national budgets, we have come out with typologies or types of programs you could find, and that is the closest that we reach to consensus. So the way that the Sun budget analysis is designed, it is to support a country and its stakeholders to track what it thinks is relevant to nutrition across time. It is not exactly designed to allow a comparison because of the differences in interpretation across countries. With that said, in the last 5 years, we have now come to a point where we can identify certain types of programs across sectors that are not Lancet specific, but that we know are sensitive to nutrition and that you can probably find in your national budget, and therefore you should. That is the only addition I would like to say before moving into the question period. But Perrine, do you have any other comments?
No, I think it was a very complete overview of what was discussed actually with the colleagues. So no, nothing to add at this stage. Thank you very much.
Thank you. So first question from Lilian. I will hand over to you, Zach. Have you come across any country that has systematized financial contribution of nutrition development partners, like in a government that account for donor contribution?
That is a fantastic question. The results are mixed. I think when I reflect, the histories of countries and the way that their budgets are designed has a lot of influence on this. For example, Vietnam, and the way that they have analyzed their national budgets is incredible. They can include financing from major NGOs such as World Vision on top of donors. Tajikistan is another very good experience where they can clearly and systematically over the years identify off-budget contributions alongside what they are spending. When we reflect, I'm just going to take one quick minute to get it exactly correct, but I believe we have 6 countries who have been able to analyze their budget 5 times, at least 4 or 5 times in 5 years, which really points to the sustainability piece. Of these countries, you would see that certain ones, such as Peru, can identify on-budget funding extremely well and efficiently. The off-budget piece of how you systematically make sure that that is being updated and introduced, it has proven, frankly, to be more difficult. With that exceptions of, say, a Tajikistan and Vietnam that are very good at doing that, it's also interesting to know that in 2019, Afghanistan, who had recently joined the Sun Movement at that time, did their first budget analysis exercise. And they were able to identify, alongside government expenditures, World Bank funding through the Global Financing Facility. These types of Sun country experiences, together with the fact that there is recent updates with the OECD policy marker, there is a hope that we can more systematically include donor financing. But it is true that the budget analysis as the starting point is the national budget. It is on budget. And then the discussions of how, when, and where you include off-budget financing, we have supplemental guidance that we designed this year to promote that. What we see, quite frankly, is that you are going to be able to track your allocations and expenditures in your national budget. 2021 is going to see a year of commitment making where both donors and the government will pledge to invest X on X.
Thank you. Then there was another question from Meron Girma. How can we work to create government interest for the results of a budget analysis? Maybe just starting with the experience of Niger, who used the commitment made by the government on the budget allocation for nutrition. They use that commitment to try to make the government accountable to their commitment, and using the right platform, making the exercise with the different sector, and I believe providing the information timely. I think that's some key aspect. They have released the report beginning of this year. We have not been talking too much about the impact of that report, but maybe that's something we can try to ask them and see how we can complete your question, Meron. But Perrine, maybe you have some addition to say to that?
No, not much. Though okay. I think they mentioned that, and it was in their presentation, that the government made a commitment for 15% of allocation, I think, in across sector, and they were using this target basically to compare against the results, or compare the results against this target and using it for advocacy. And I think it can be found in their presentation.
Zach, do you want to complete?
Yeah, I would only like to say that this is very important, and involving governments in an exercise is, I've seen it work and I have seen it not work. And one of the ways that kind of determines whether it flies or dies, their support and commitment to the results, is if they have own the exercise if they have called for it, they through the Sun focal point. It is true that if we were all to take a country in the Sun movement and reflect and look at its national budget, it's publicly available, we could all do this, we would all find different results, and our conclusions would be slightly different. When a government has agreed to its need, they have either identified the need of technical assistance or they have produced it themselves, the end result is that they can't, it is a sine qua non that they validate the exercise if they called for it and implemented it. It is true that in some countries where a civil society group would do a great budget analysis work, the governments at times do not recognize the findings for one reason or another, and it will be very, very difficult if the government hasn't already commissioned that financial tracking exercise to then get buy-in for the results. With that said, the way in which we are seeing the best advocacy strategy is the crucial link where civil society groups are able to fulfill an advocacy role while managing that balance where the government maintains ownership over the exercise. And parliamentary engagement is the real missing link where we can support countries better and civil society groups in country using the results from the budget analysis that are validated from the government to compare against your financing commitments, say which you pledged in a Nutrition for Growth previously or which you have pledged in 2017. And this is our thinking behind that. The question, does the budget analysis include the budget for the workforce working in the public sectors? Frankly, and as I have explained before, what you will find on a national budget is not the complete picture. I love that expression where there is an elephant and 8 blind men touch different parts of the elephant and they have a different conclusion of the whole. The national budget is one part of the elephant. And when you look at that part, you will include the budget and expenditures for the workforce. It is often true that governments may largely be supporting the human resource component of a program and external financing puts in the infrastructure or the other inputs. Sometimes that certainly happens.
Thank you. Sorry, I was disconnected and I had to reconnect. Thank you, Zach, for this complete answer. There was this question from Arigash to see, once you have this, how do you make government increase their funding for nutrition? Well, there is no magic recipe for that, but I think one of the great added value of this exercise is that maybe you know or you have some information that the commitments have not been fulfilled, but that sort of study with the different people involved, the different sectors involved, then gives you a real figure that you can start talking about and work around. So at least you have it here written in a report where everyone agree on the results. So that's the first starting point in the discussion. Maybe Arigash, I take this opportunity to give you the floor and see and give us insights from your experience in Ethiopia on this kind of nutrition budget analysis. I know you have done an exercise that's been done in Ethiopia with the support of R4D. Maybe you can say a few words on that if you will.
Thank you, Julian, but I'm afraid that I may not give you the right answer because what I know is the financial tracking exercise was done in the country by R4D, by an office called R4D. To be honest, I just have only the report, but I cannot say anything right now because I didn't read the report, Julian.
No problem. Okay.
Yeah, thank you.
Okay.
I have had some connection problems, but I'm not sure. Have we covered the question of Eric about whether there are efforts for within OECD to have a module covering nutrition and food security?
Thank you, Ingo. I'm not aware of that. Does anyone have this? Maybe Bill, do you have any answer to provide to Eric?
William, do you know anything about efforts at OECD to have a module covering nutrition and food security?
That is a fantastic question. We are looking precisely at that. The first step that was done in 2020 was the joint publication with the FAO focusing on the Sun budget analysis in the agriculture sector, where food security is one of the major entry points. But insofar as creating a module, we are looking at that with funding and partners across USAID and FAO to see where and how we can do that. But there are things like the FAO Academy, which would be a perfect entry point for us to make a concise, several, 120, 180 minute module on that point. And we are exploring that.
Right. Can I add additional information from the perspective of donor financing of nutrition?
Please, Bill, and could you introduce yourself to the group as a...
Yeah, hi everybody, nice to meet you. My name is Bill. I'm the resource tracking team leader for the EU nutrition investments. So I come with not a country perspective, but a donor perspective on how to track nutrition commitments. And I suppose I wanted to say that if you're interested in identifying donors' investments in nutrition in your countries, then you can use the OECD DAC database, or you can use it for nutrition-specific investments. This is an online database that's available to the public, and it identifies nutrition-specific investments. And in the future, it will identify donors and nutrition-sensitive investments with a nutrition policy marker, which I think William referred to. That's being introduced at the moment. So that may help to complement information on government investments in nutrition in your countries. Thank you.
Yeah, that is a fantastic point. I have had the pleasure of supporting the other end, governments and not donors. And so what I have seen develop with the OECD policy marker as I reflect is something like this. 2013, the Nutrition for Growth Summit there, it was found that donors had an idea to track financing, but Sun countries didn't really. And the Sun budget analysis exercise as a method was designed off the donor experiences. That was implemented in 2014 with rollout in 2015. And now we're coming to a moment 5 years later where there is new advances with the OECD policy marker. There will be 5 years of country experiences trying to identify nutrition-related financing, sensitive and specific. And my hope, to be candid and not quite technical in a response, is I'm hoping that our most meaningful experiences in tracking on budget and off budget financing will go as follows. You can identify your national budget. It's publicly available anyways. The Nutrition for Growth and whatever commitments come out of that can be tracked going forward, because everyone at today, 2021, will realize if you're not tracking your commitments, what are you doing? And my hope is that we can, when this new OECD policy marker rolls out, so that it may be more robust in 2022 than 2021, we will have financing commitments established in 2021 where we can track those commitments on top of unbudgeted financing. And that will be the quickest and fastest way, such that we can have something meaningful by 2021 that is systemic and sustainable.
Thank you. Thank you for that. Maybe, Prosper, can I give you the floor? You had a question, it was answered in the chat box, but also to mention about where Lao PDR is standing at the moment regarding those sort of studies.
Yes, good afternoon from Lao PDR.
Thank you.
So as part of the National Nutrition Committee Secretariat's work, every year we try to support the government to conduct a financial tracking of nutrition investment in the country. Now, our experience is that it's been very difficult to track the data from the government side, simply because of how the budget is structured in the country. So as part of the service delivery system, nutrition is part of the health portfolio. So within the health portfolio, you will not readily see nutrition as a line item running through for you to be able to track how much the government is actually committing to nutrition and how much also to the sub-national level. So from the government side, it's been relatively difficult to really track the financial, allocation and the expenditure. However, we also have a very strong development partners in nutrition community in Lao PDR, and the network volunteers data every year. So usually in December, the various development partners, an Excel-based form is sent out to them where they really indicate how much they plan to spend in the year and how much they actually spend in the year. So from the side of the development partners, we were able to track starting from 2016 how much the GPs have been spending in the country. So we have a pool of data that we can really track how much the GPs have been spending in the country. But of course, from the side of government, it's been relatively difficult to track how much the government is really spending because of some of these limitations. But we are using that as an entry point to advocate for the government to really strengthen its budgeting system to be able to track nutrition. And that is something that we are really supporting with the support of our development partner, the EU. Recently, a consultant was brought on board to help us to actualize that. So we hope that in the coming years, we'll be able to support the government to be able to help us to do that. Yes, so William is through the consultant is called Shah Ketishi. So they just submitted their draft report and there are very interesting recommendations that we're sharing with the government very soon.
Thank you.
Thank you very much.
Just a follow-up question is we are often limiting the information that is available. Maybe to Zach and others, is there any experience where through those exercises we saw the information available that was more and more available and detailed, and where nutrition was specifically mentioned? Has there been any progress in the information system?
So basically, just like I indicated, we brought a consultant on board this year. So the consulting team have just finished its work and they submitted to us a draft report. So the recommendations, we are yet to engage government to see how we can actualize that. But I can see that there's very high interest in getting that done. The World Bank is highly interested, the EU is highly interested, because they are supporting the government through what they call the budget support program. So there's a lot of investment going into nutrition, and they are all committed to supporting the government to improve its budgeting system to accommodate nutrition. So this is actually a joint effort, and we hope that in the coming years we'll be able to improve that particular issue. But from the side of NIPN, the value addition of NIPN. So currently we have successfully developed our NIPN dashboard and data repository, which is yet to be launched. But the phase 2 of it is to see how best we can migrate this Excel-based tracking that we have been doing every year onto the online platform. So a portal will be created on the NIPN dashboard to illustrate how much is being spent on nutrition year in and year out as part of the NIPN dashboard and data repository, which is something that we want to go into next year. So we hope that from next year it will be readily available to whoever goes into the website to track how much we are spending from the development partner side as we work progressively to bring government on board.
Thank you, Prosper. In budget tracking, maybe you can share with us your experience in Bangladesh, Dr. Rahul?
Yeah, Bangladesh has some experience tracking food security and nutrition investment, I should say. In fact, it was started in 2011 through the, that Bangladesh is one of the few countries who formulated the country investment plan for agriculture, food security, and nutrition in 2010. And that was the first country investment plan, and it went up to 2015. So each year Bangladesh had to track the investment in food security and nutrition. So if you look into the website of Ministry of Food and Disaster Management, Ministry of Food, you will find the reports, series of reports, 2011, 2012, 13 up to 2015. Then again in 2016, 2017 in fact, Bangladesh formulated the second country investment plan for a nutrition sensitive investment. So after that, I think we had only one report produced. It has a specific institutional mechanism to track the investment. So I don't know how much time I have, but I can briefly talk about it. It is an interministerial institutional setup through which this tracking takes place. Coordinated mainly by the Ministry of Food. They have thematic group from taking focal points from each of the relevant ministries, and what they do, they track the investment through projects as well as through recurring programs under the revenue budget. In Bangladesh, you know that we have two types of budget. Budget is classified under major two heads. One is we call it development budget, which takes into account the investment through the projects, and the revenue budget, we call it that those are recurring expenditure. So those are not held through projects or programs. So through the focal points, we collect the data of the investments, budgets, as well as expenditure.
Can you go?
Mm-hmm. So that's how the CIP monitoring report has been produced. It has series of report, and the other initiative we had in 2017-18 with the support of UNICEF. That is, we call it the Public Expenditure Review on Nutrition. That was an initiative from the supporting by the UNICEF, and also an initiative of the Bangladesh Nutrition Council. You know, the Bangladesh National Nutrition Council is the apex body for nutrition, for coordinating with the 22 ministries who are involved in the implementation of nutrition-related programs. So that had a specific methodology. That was also assisted by Oxford OPM, Oxford Policy Monitoring and Review, organization from the Oxford University, I think. And they had to draw some specific methodology to track the investment. Mainly that included to work with the Ministry of Finance. You know that Ministry of Finance has some coding. They use some codings for expenditures and budgets, and the codes under each of the ministries which are relevant to nutrition and nutrition sensitive as well as nutrition specific programs. They try to track those codes and the expenditures as well as allocated budget under those codes, and using that they produced a report. That means BNNC produced a report with the support of OPM as well as UNICEF. And I have shared the report, which was produced in 2018-19. In the chat box, you can see the link, and you can also read through. It has some limitation because it was the first of its of the initiative of its kind, and I think that Ministry of Health and the Bangladesh National Nutrition Council is also looking to have similar exercise in the years to come, to based on the lessons they have learned, based on the limitations they had in the past, they will try to improve the methodology and have a good method of reporting investment in nutrition. Thank you.
Thank you. And as the exercise started a long time ago, the methodology, has it evolved, has it improved, has it changed?
Well, as I said, the two types of exercise I mentioned. One was the monitoring of the country investment plan for agriculture, food security, and nutrition. So that was carried out by Ministry of Food, and that was basically mainly based on interagency mechanism committees. They monitored that. But the PAR end, the public expenditure on nutrition, as I said, that was focused mainly with the coding system, expenditure coding system of Ministry of Finance. So you can say a different type of methodology we have used.
Okay.
I think the PAR and public expenditure on nutrition report, the way we have produced it, I think it was the first of its kind. So it has to evaluate a lot in the years to come. So and the objective of the two reports is slightly different. So we cannot compare it.
Thank you. Maybe another experience we could share. I don't know if you remember, but there was a webinar also done on this one. There was in Guatemala. They have done a study on this, and maybe Perrine, as you were following this study, you can recall us a bit their approach and a few words about what they have done with the brief after.
Yes, sure. So this study was part of actually the work done in the platform with the NIPN entirely. It was supported by an external consultant for probably 2 to 3 months, I can't remember now. And it was a very thorough analysis of investment, going from planning to disbursement, actually, in each sector on nutrition, and looking at 10 years, the past 10 years. So looking at the probably 3 or 4 different multi-sectoral nutrition strategies that were aiming to prevent stunting in Guatemala. So that was a retrospective study, quite thorough study. They had the chance, in brackets, in Guatemala to have well-organized systems in terms of tracking of budget allocation and expenditure, which is accessible, on which they could also base the study. So the report, the results are captured in a report, full report, which is in Spanish and is available in the NIPN website. But it's been used, and we have presented, I think, in a couple of other webinars. It's been used to also draft a brief, which for the global level, which you can find also on the website. And those 2 documents were actually quite instrumental in leading the discussion with the government and presenting the result to the government. So that was part of high-level advocacy that was led by the team, and basically thanks to the results, the CESAN, who is the body in charge of the multi-sectoral coordination for nutrition and food security, presented the results to Congress, which has led to some discussion afterwards and within the government actually on how to move forward. Mainly in the funding, that raised issue in the funding, of course, of nutrition sensitive intervention, and in particular certain sectors that were showing a real gap compared to the allocation and planning, basically. Yeah.
Thank you. Thank you. And just a reminder that the webinar presenting the experience of Guatemala is available on the NIPN website, of course. Just maybe before giving the floor to Ingo for the conclusion, maybe Zach, if you want to thank you for being here for this English webinar, but also for the French webinar. Maybe if you want to have a few words, especially on what is now the future in terms of what is coming next in this budget analysis approach and nutrition tracking in general, and also maybe now that you have discussed a bit with the platform, how do you see the role of the platform in this exercise? Maybe if you have a couple of words on that.
Hello, can you hear me?
Very well.
Perfect. 2021 is being primed as the moment that the Sun movement is prepared to support Sun countries and its stakeholders in whatever way they want to track public financing. But our honest appraisal is that the Sun budget analysis is going to be one of the most utilized methods in that year. So the timeline of what we are looking at is to have June 18th, a Monday, is when we will start the Sun budget analysis exercise. We have a number of TA providers that exist in country that have already been confirmed to be able to take these types of requests if the government requires TA. And we also have a new last resort TA mechanism task. That is to say that governments who can do a financial tracking exercise will do so, and those that require technical assistance will be well represented across the Sun movement. My anticipation is that we will see between 20 and 25 countries doing a financial tracking exercise between Q1 and Q2 of 2021. The timeline is to say Q1, Q2 is when this work stream will be going full tilt. I would be happy to provide updates perhaps to you, Julian, and you can relay it to the participants of the last two webinars here so that everyone is aware that these are happening. We will contact countries the 18th of January, and over the next 2 or 3 weeks, we will get the appraisal of those that will do the exercise and those that will not. And I'd be happy to keep everyone on this call abreast with who is planning to, who is involved, and who isn't. And the last thing to consider is that with a virus as it is and the recession as it is, we believe that the Sun budget analysis method will be the preferred method simply because it can be done in 60 days. We don't need to take 12 or 18 months to do an exhausting review of public financing because we know countries have been impacted. We know the real GDP changes that are going to happen. So we need something that is fast, efficient, and government validated. That is all. Over to you, Julian.
Okay, I think instead of over back to Julian, then Julian already referred to me to do the final conclusion and potential next steps, which is a daunting task because concluding some thing about a topic as complicated and complex as investment studies, investment tracking and nutrition is not easy. I mean, we heard many things, and that it is as I mentioned, a very complex, challenging task. Most countries these days have come to a point where they develop multi-sectoral nutrition plans, multi-sectoral plans of action for nutrition, however you call them, multi-sectoral. And those then usually get costed. And that is already also a daunting task to identify how much would it cost to really fund all those planned and proposed activities in the multi-sectoral national plan of action. But then a costed plan is not automatically a funded plan. So where does the funding come from? What are the sources and how much actually is funded? Do we ever find out actually what of the costed plan can and will be implemented and is funded by whom? We have different sources. Private sector may do something that impacts on aspects covered in national plans and they are never part of it. And we have probably no clue about any kind of private sector investment. We have government investments, which in many cases, as also was pointed out, do not even fund the majority of the nutrition interventions in the country. And in those cases, to track that investment and to get the grip on what really is done and where does it go into, where does the dollar go to, then it's also complicated because often it relies mainly on the health sector information. But if we have a multi-sectoral plan, then there's a Ministry of Education, Ministry of, I don't know, Food, Agriculture is even easier, but there are others, like, as I said, Ministry of Education, maybe Urban Development, Public Works, which also play important roles in the multi-sectoral plans through WASH investment in WASH infrastructure. How do you account for that? Because even when in those sectoral budgets, it may not be that easy to really separate out now